I'm Dr. Daniel KAntor, Neurology in Real Time, and I'm joined here by a doctor and author, by Dr. Mary Ann Picone, who is the medical director of the Holy Name Comprehensive MS Center in New Jersey. Thank you so much for joining us. You have a new book coming out. It's in pre-order on Amazon.
Yes.
Tell me more about it.
Well, I'm pretty excited about it, Daniel. The book is called Multiple Sclerosis for the Non-Neurologist, and it came about because, as you probably experienced, so many patients often come into the office saying the doctor that they've been seeing, whether it's their internist, their OBGYN doctor, ophthalmologist, doesn't really understand their MS. And with all the new therapies that we have, what is it now? We have 16 new disease-modifying therapies. Many physicians who are not neurologists don't know what these therapies are, what their adverse events are, what drug-drug interactions they may have for our patients. And with so many of our patients going to obstetricians and dealing, for example, with pregnancy issues, it's so important for other specialties to be more aware of the problems that MS patients face. And it will help us as neurologists, it'll help our patients, and it'll overall be able to improve the care that we're providing, both neurologically and in the comprehensive approach.
As a person who thinks about reading a lot, I was actually an English major. Besides engineering, I was an English major in college. And I think about how people read differently today than how they read 5 years ago, 10 years ago. People read in 140 characters or 280 characters. So now they have to read a full book. And I'm saying this even as doctors, because doctors are reading less and less. Even our notes. We don't read notes. We don't write descriptive notes. We do check boxes to satisfy insurance companies. So what's going to happen is things are going to change rapidly. In MS, they change faster than everything else in medicine, and that's why we're blessed, really. In 2000, we had some medications. In 1992, we had 0 medications. Now, in 2019, we just had approval of 2 new medications. We went from 0 in 92, first one in 93. We now have 14 separate branded products, 2 unbranded generics, and 1 branded generic disease-modifying therapies, not to mention symptomatic treatment. But that's going to change over time. So how are you going to update the book? Are you going to update it online? Are you going to just put out new print releases? What's your plan in terms of that?
Well, there is going to be an e-book companion to the printed version, so that will allow more flexibility in updating as time goes on, and then there'll be the second edition. But we try to make it right now as comprehensive as possible, not just with the therapies, but with the overall aspects of dealing with patients. For example, vaccinations. So many questions come up. Is it okay for patients to get live attenuated vaccines? Can patients get the flu vaccine? Can they, with the measles epidemic that's going on in the country, how does that affect MS patients? And depending on the therapy that they're on, can they get the measles vaccine? So these are things which will be timeless, that will be answered in the book, in the chapter on internal medicine. And the epidemiology, although that does evolve, we try to present the most updated version as possible. But urologic issues are pretty much standard, and I think even with the passage of time, it'll still be the same issues. And also with sexual dysfunction and aesthetic issues that patients can present with, and the surgical problems, how to manage the surgical patient with MS who's going in for back surgery, or how to distinguish things like carpal tunnel versus MS-related upper extremity problems. So these are things which, no matter how much time goes on, will still be important for other doctors to be aware of.
Well, Dr. Picone, you're exactly correct, and thank you for pointing out that there are timeless features of what we understand about MS. Some things are going to come and go, and even medications. We saw just in the past 2 years a medicine get approved and then be taken off the market. But the principles of placing the person with MS at the center of the team, that's not going anywhere.
Exactly.
That's staying here.
Exactly.
So if somebody back home wants to buy this book either for themselves, because they say they have enough medical knowledge, or they want their primary care, or they have a family member who's going into healthcare, how can they go and order? What should they search for?
Well, I think what you said is so important. First of all, that this is meant for other specialties also neurologists, but particularly other specialties who are non-neurologists who deal with MS patients to improve their care. So patients, doctors, and can get it on, or anyone can get it. It's available on Amazon. Right now, for pre-order. The publisher is Wolters Kluwer, Lippincott. And right now it's available on Amazon, and the book should be available for publication by July or August of this year. Thank you.
Well, Dr. Picone, thank you so much for sharing, and thank you so much for taking time out of your busy schedule to write such a book. And I want to thank you for being with us, and I want to thank all of you at home for joining us on Real Time Neurology.